23,500 Windsor, Cross Street, Frederick. Sick person, BLS response, ambulance 727, respond on 7 Bravo, box area 27.5, time is 22:32. Alright, so here we arrive on scene at Clarksburg High School. My scene does appear to be safe. I do have my BSI, I have my eye protection on, I have my gloves on as you can see, and I have my surgical mask on due to the times we're in right now. This appears to be my only patient, as we were called for. I'm going to treat this as a nature of illness because you have no suspected trauma injury or no signs of trauma. We do not need additional resources at this time, and I'm not going to consider the reason for C-spine right now, just because we got called for a sick person, but that can change. So let's begin our primary assessment. General impressions here is this appears to be a 16-year-old male who has dry skin, clammy, pale skin. He appears to look like he's having abdominal pain. He's kind of like in he's sitting in Fowler's position. He's holding onto his stomach a little bit, or abdominal area a little bit. I'm going to start my AV pool. Sir. So he's responding to me, which is cerebral stimuli, and he does appear to be alert and awake. His eyes looking at me, so that's a part of the AV pool. I'm going to start my airway. He did respond back to me, so his airway is open, and nothing's in his airway. He is breathing adequately. I'm going to check for your pulse. You have pulse, which is really good. We know that you have blood circulating throughout your body. Alright, so at this time, I'm going to treat this patient as a priority 3 trace patient and start to begin transport. But first, we're going to get a set of vitals. I'm going to have my partner come in and take vitals, full all vitals. Okay, and while my partner's doing that, I'm going to start my secondary assessment. Alright. Hi, sir. How are you doing today? My name is Ginger Boyd, and I am an EMT here to help you. So can you tell me the signs or some of the symptoms you're having today associated with your abdominal pain? Okay, so the patient is telling me that his symptoms is that he feels just pain in his abdominal area. Can you point to where the pain is at? Pain is right here. Okay, and that appears to be in the left upper quadrant. So I'm just gonna that looks like that appears to be his stomach area. Okay, so when did this start? Okay, at lunchtime. Okay, and can you tell me the quality of this pain? Okay, so patient is telling me that it's just like really, it's like almost not like it's not stinging, right? Or so he's telling me that it's like it feels like there's like waves. Okay. Can you tell me what provokes this? So mainly like when you move around. Okay. So it's good that we have you kind of in a still position right now. Can you tell me? The region. Alright, so the region is in the abdominal area. Left upper quadrant. Alright. And can you tell me the severity of this pain? 0 being the least pain and 10 being the worst pain ever. Okay, so it's around a 6. Alright. That is kind of in the upper range. And when did this start? Correction. How long has this been going on for? Okay, so just while you're eating lunch. Alright. So are you allergic to any allergies, or do you have any allergies? Okay, no, you have no allergies besides just regular seasonal allergies. Okay. Do you take any medications? No, you don't take any medications. Okay. Do you have any past medical histories, or do you have like any past medical problems, medical histories? Nope. All right. What did you last eat? Oh, so you had Thanksgiving food and some cookies and okay, so that's probably okay, and you're eating it really fast? Okay. All right. And what were you doing that led up to this a bit of us being cured and your stomach hurting? Okay. So you were eating really fast, you're playing, you didn't really let your food digest properly and yeah. All right. All right. So, we're gonna take you to the hospital. I think it's best for you to go to the hospital. Get you checked out. Make sure everything's okay. We're gonna contact your parents. Okay. This was gonna contact your parents and let them know that we're taking you to the hospital. Hopefully your parents will meet you there, and they should. And also, we're gonna treat this patient as a priority 3 patient and transport you to the hospital. All right, and hopefully you can feel better. And yeah, all right, let's go.